Hi, my name is Laura Kelsey, and you are listening to CHLY 101.7 FM in Nanaimo.
Attention, the following program discusses matters of health and wellness and is for educational purposes only and does not provide professional medical advice. Please consult your physician for personalized medical advice if you're seeking medical advice, diagnoses, or treatment. The views and opinions expressed on this program are that of the host and or the views of the persons interviewed and do not necessarily reflect the views and opinions of CHLY 101.7 FM, its staff, sponsors, volunteers, or members.
Welcome to episode 22 of Orange Bench Radio here on CHLY Nanaimo. I'm your host, Derek Poderico, your friendly neighborhood family doctor. On this weekly show, we step back in time and groove to the beats of the 80s, 90s, and 2K, blending these nostalgic tunes with insights into physical, mental, and spiritual well-being. Today's show is called Embrace the Chaos, Adult ADHD. Our special guest is Dr. Tania Oommen, an adult psychiatrist at Nanaimo Regional General Hospital with a special interest in adult ADHD. If there's one thing that defines ADHD, it's the feeling of competing signals, thoughts racing, distractions piling up, and the struggle to focus through the noise. To start things off, Synchronicity 2 by The Police captures that tension perfectly. Chaos bubbling, under pressure building, and the sense that something's gotta give. Sound familiar? Let's begin. Here's Synchronicity 2 on Orange Bench Radio. That was Synchronicity 2 from the album Synchronicity by The Police, released in 1983, a song about tension building beneath the surface, something a lot of adults with ADHD can relate to. The restless energy, the feeling of being pulled in a million directions, and that ever-present sense that something is just out of reach. But ADHD isn't just about the chaos, it's about understanding how the brain works, how to navigate the world, and how recognizing it can make all the difference. Now let's stay focused and turn our attention to our special guest, Dr. Tania Oommen, who joins us on Zoom. Welcome to the show, Tania.
Thank you. Thanks for having me.
So I know we've had a few conversations in the past about this four-letter word ADHD, and I'm just curious if you might be able to tell the listeners a little bit about what you do and your interests.
Sure. So I'm a general adult psychiatrist. I came from Edmonton a few years back, 2021. Started in Nanaimo, mostly in outpatient care. Now I'm primarily in the hospital. I do a little bit of outpatient still. In Edmonton, I was doing mostly group psychotherapy work with some outpatient care. ADHD came up in the context of the outpatient group psychotherapy work.
Right.
Most of my patients there, the vast majority had significant trauma. Right. So they'd be processing trauma, discussing aspects in their lives that have arisen out of the context of their trauma. But there is a handful of people, every few groups, that it was obviously very important to them. Their emotions were strong. They were present, but they often couldn't remember much of the information after.
Interesting.
And even when people were talking about their own emotional experiences, their trauma, they would start drifting off, which would offend some people. And a lot of them were very distressed by it. So that's, I'd say, one of the key places where I started looking into.
Ah, okay.
Another one was seeing a presentation by a psychiatrist, Dr. Sarah Binder, who's from Calgary. She came up to Edmonton to present and was talking about ADHD in women.
Right.
And that really struck a chord, and things started falling into place as far as recognizing, well, there's a lot, as you're well aware, there's a lot we don't know about women's health, period. And it's been understudied for decades and decades. But seeing that a lot of women with numerous, quote unquote, psychiatric symptoms might also be struggling with symptoms of ADHD was very eye-opening for me. So
yeah, no, I've seen that in the office as well. Interesting. And now with social media, ADHD seems to be on everyone's mind. Yeah, your approach these days, I mean, everybody comes in is wondering if that's their diagnosis. Do you have any words of wisdom on how to approach that?
Yeah, I'd say it's been quite a big shift since I first started treating it several years ago till now. I'd say back then it was this very under-recognized, just under-thought of condition that was probably affecting a lot of people. And now, since the COVID pandemic in particular, I think awareness of it skyrocketed with lots of psychoeducational videos, first-person accounts on social media, which I think overall are very good things. It has, I don't want to say tipped in the other direction, but it has really increased awareness of ADHD to the point that I think sometimes it can be misidentified as the primary cause for somebody's struggles, when in fact there might be other more pertinent issues at play acutely.
That's well said. Like a hyper awareness, as I've learned in medicine, because I've been doing this for a few years. It's kind of like a pendulum. It goes back and forth and back and forth, and it can sometimes be overrepresented or overthought of, and there may be other underlying diagnoses, like you say. So have to be thoughtful about those things, of course.
Mm-hmm. Well, that, and I think, as with everything we see globally, internationally, politically, with all these pendulum swings, there can be counter-reaction in the other direction. Yeah. So then, and including in the medical field, a large reaction of, well, see, everybody thinks they have ADHD, so this doesn't exist at all. And that's also not fair. So
totally. No, I mean, as a physician, you come in with a fair bit of humility and just saying, okay, let's be, every encounter is a new one, and you have to kind of start fresh.
Yes, absolutely. So
on that, go ahead.
So just in an interesting time as far as we're at the apex of some of those swings right now.
We then discuss diagnosis of ADHD and what resources are available. If a person does have worries or thoughts that this might be their diagnosis and they don't have access to primary care, as said, 30,000 people in Nanaimo are not able to have a family doctor or a nurse practitioner. There are the UPCCs and other accesses to care, but can a person go online? Are there resources that you use and would recommend?
Absolutely, yeah. And I often recommend that first line just in order to get more specialized care. The one thing I would say is online, there's many more psychoeducational resources now than there used to be. So there's, honestly, I wouldn't even give names. There's just so many available. Okay. A lot of them go through established institutions and healthcare facilities. And there are national organizations that promote the study and care for ADHD. So I'd say if somebody has a chance to look through those and just see, okay, does this fit? Does this fit as a lifelong pattern? Then it's worth taking some next steps. So as far as other places people can go, I am aware that TIA Health, TIA, is an online resources they have.
Nice.
Frontline primary care, but apparently they also have access to a psychiatrist who specializes in ADHD. I am aware also of the Par Heart Clinic in Vancouver.
Right. I've sent a few people there. Yeah.
There's a Forpay. Talk with Frida. FRIDA is another one. Also Forpay. So TIA is the only one I'm aware of that's covered fully under
by MSP.
By MSP, yes. The other ones are on Forpay. West Coast ADHD is another one that deals with adults, also virtual. So all of these, I think, are based on the mainland, BC, but do offer testing, treatments, suggestions, and potential follow-up. I believe one of them may also offer group psychoeducation, which is also very, very important in ADHD. So it's a matter of kind of browsing through some of those sites to see what the best fit is.
As mentioned, we'll be sure to post some of the resources discussed on our Blue Sky and X feeds at Orange Bench Radio. We'll get back to more of Dr. Oommen's wisdom in a moment, but as you know, Orange Bench Radio is about the music too. Dr. O chose this next song, and it's also a very good metaphor for the ADHD experience. The feelings of time slipping, of moments fading in and out. Here's Fade to Grey by Visage here on Orange Bench Radio. That was Fade to Grey by Visage, released in 1980. We're continuing our conversation with Dr. Tania Oommen about adult ADHD. We then chatted about how to treat from a non-pharmacologic and a healthy lifestyle perspective, as well as with discussion about medications. So that loops back to, sometimes medications are the answer, or always the answer. I'm just curious about, our world, this hyper-connective world of social media, etc. Lifestyle still plays a role. I say, exercise is medicine, food is medicine, relationships heal. Those are kind of the pivots of some of this stuff. But I'm just curious, do you have any thoughts about lifestyle and other modalities of treatment besides medication?
Absolutely. I'd say medications can be very useful, but they're not for everyone. They're not tolerated by everyone. And to be honest, on the milder end of the spectrum, not everyone even needs them. It's a matter of how can we implement such a lifestyle where we're recognizing deficits that might be present and chronically present, again, lifelong, that are also tied to a lot of strengths, creativity and spontaneity and a lot of fun stuff, right? So I think acceptance first is one of the big pieces. So not just seeing it as this blanket disease that needs to be treated or cured. And there is no cure, and I personally don't think there should be. So I think within that framework, understanding that, okay, I have this set of gifts, I have this set of limitations. My brain is frequently trying to do something more interesting than whatever I'm doing right now. So what do I need to keep my brain on track? So there are a lot of resources online now, which is one of those big reasons why I suggest people just start off online. Things like schedulers, planning, ADHD diaries, alarms, alerts, like some people have alerts before they're alert because there's change transition resistance for people with ADHD. Transitioning can cause emotional distress. So getting a timer that in 10 minutes, your next timer is going to go off can actually help prepare the brain for some of these day-to-day things that are challenging. There's gamification. Checklist, sticker systems. So some of these things that might sound trite or silly, but are actually these small ways of increasing regular dopamine release that is under-released in the ADHD brain, unless something big and exciting is happening.
Okay. No, that makes so much sense. I really appreciate your perspective on saying that, it's a gift in many ways. It can be. And as somebody that I'll just say personally speaking has had some of those traits, it can be very helpful, but also not so helpful, and understanding how to make it work for you, so to speak.
Yeah, absolutely.
But when it comes to the lifestyle piece, eating regularly and exercising and getting enough sleep, which we sometimes are all under insomniacs in some ways because of screens and other things. It's still the basics that sometimes can go a long way to help as well.
Absolutely. Not sleeping is one of the fastest ways to destroy any good mind, and the ADHD mind is no exception. And a lot of people with ADHD forget to eat or drink, and how engaged they are and what they're doing. So, I think those are great points. Just making sure you're staying top of healthy life on a regular day-to-day basis.
Great. Yeah, that's the good old-fashioned family medicine as well. I read a book called Crazy Busy by Edward Hallowell. I don't know if you know, it was way back in the early 2000s. But he was a psychiatrist out of the States, and I think he does, he has lots of ADHD kind of ideas. But the book was quite good. It was called Crazy Busy, and, it really put home a lot of those points that you just talked about how, using schedules and timers and the lifestyle stuff. And boy, it sure makes a difference. And in the office with my patients, I see that too.
Hi, I'm Dr. Anita Rashidi, and you are listening to Orange Bench Radio here on CHLY Nanaimo.
Anything that you want to say about medicines these days, just to sort of give patients a bit of an understanding?
Yeah, I think you summed it up nicely. I see medications as important and allow people to implement those lifestyle changes. So it itself is not the treatment or cure. It's an aid to help in the process. I would say medications are frequently misunderstood. In particular, I'd actually say in the medical community, there's a bit of doomsday catastrophizing. It shares an unfortunate name with several of drugs of abuse by calling them stimulants.
Right.
It's important to know that in numerous studies, it is shown that the medications do not increase the risk of drug abuse, and it actually decreases the risk of drug abuse over time. And the longer the use of stimulant treatment for ADHD, the decreased risk of stimulant or substance abuse. That substance abuse is up at rates at around 60% for untreated ADHD population. So I think a lot of it is just some misconceptions about the danger of the drugs, which in my practice of treating so many people, they're really not that exciting. For people with ADHD, you take the meds, most people will say their minds feel calmer, they feel more settled. Yeah. I've had several people say, is this what normal people think like? I've had several people say it's the first time they've had quiet in their heads, they felt peace. So again, I think because of the name stimulants, some people think, oh, people are getting high off of them, but it's actually exactly the opposite. Yeah. If you give stimulants to people who don't have ADHD, the effects will be very different. I don't think particularly pleasant. So I think recognizing that, they're a treatment, they're an aid to help with instilling lifestyle changes, just to make life more manageable for people who are struggling with ADHD symptoms, especially I treat adults. So I would say adulting is one of the hardest things in ADHD because it's so much more boring than being a child. And so
well said.
So how do I tune in to actually do the things I have to do, not because it's fun, not because it's exciting, but because it just has to get done. And
got to get the done. Yeah.
Yeah. So that's where medications in combination with all these other skills can be helpful.
Yeah, and I appreciate you bringing that up about the medication. I'll just say in my journey as a family doctor with addiction, and how many individuals in my practice over the years, and just observing how they gravitated to the over-the-counter drugs, i.e. alcohol and other illicit drugs, to treat, which in the end was like an ADHD anxiety issue that was the cart and the horse. And so, now we're getting a better understanding. Maybe it's the other way around. The ADHD is causing the addiction, or at least there's a correlation.
Yes. Oh, there's a very high correlation. And I've seen it in my patient population. And people don't want to abuse drugs. I think that's something too for medical professionals to remember. I sometimes give talks on ADHD, and I'll get this sense of resistance, like, oh, people are just drug seeking. And people come to us as physicians not because it's fun either, right? They come to us because something's not working. So I think it's our role to figure out, so what's not working for you, whatever that looks like. And for many of them, it's that they're trying their best and they still can't get things right. So I think having compassion for the physician and trying to help them along the way is huge.
Beautiful words and beautiful questions. Thank you. As we wrap up this episode on adult ADHD, I wanted to leave you with a track that captures the energy, unpredictability, and sheer intensity of today's conversation. Originally made famous by Talking Heads in 1983, this is Burning Down the House, a rockin' remake by The Used, here on Orange Bench Radio. So good. That was Burning Down the House by the Used. Lines like, my house is out of the ordinary, there has got to be a way, capture the ADHD experience, thinking and working differently, but always finding a way forward. So keep fighting fire with fire. Thank you for tuning in to Orange Bench Radio. Special thanks to psychiatrist Dr. Tania Oommen for her time and wisdom today. You can catch this and previous episodes at orangebenchradio.ca. For questions, comments, or ideas, reach out to us at orangebench@chly.ca or follow us on Blue Sky or X at Orange Bench Radio. Remember, it's all about hope and healing. Join us next Saturday at 9 a.m. as we kick off your weekend with more music and conversations that matter. A big thank you to Jesse Woodward for producing and Arby Frew for technical support on today's episode. I'm Derek Poderico, your friendly neighborhood family doctor, and this has been Orange Bench Radio on CHLY Nanaimo.